Hello, I'm Dr. Maria Sulindo, Integrative Medicine from Pasadena, California. Today I'm sharing with you what I know about regenerative medicine. It is real now, okay? Regenerative medicine, it is real. So let me start with telling you that our body is meant to have its own ability to regenerate by itself every day. So other factors can influence this regenerative process to make it as a medicine, such as genetic mutation or infection or severe trauma and many others. And those factors slow down the stem cell effectiveness of the natural regenerative process. So this pillar I included in healthy aging is not mature yet, meaning that regenerative medicine is still being cooked and many are yet to be reviewed and approved by the scientists and also by the clinicians. In integrative medicine field, we have to consider ways to help our patients to prevent premature aging. So when our own stem cell failed to regenerate, then the doctors will help using pharmaceutical products, okay? And they would offer something in within this field called cell therapies, organ transplant for organ failure, tissue engineering repair, stem cell therapy, gene therapy, and believe it or not, organ cloning. I'm considering cloning as a topic in the future. Regulatory science is still complicated. We learn it from conferences and the scientists themselves. FDA, Federal Drug Administration, is working hard with the scientists, the clinician, and this involves intellectual property, financial properties, and someone will make money, okay? So, but the result is very promising. And this is the future of medicine. As a physical medicine and rehabilitation specialist, we cannot avoid but keeps bumping into this area, so-called regenerative medicine. Why? The most common conditions in rehabs are one, stroke, right? Patient with stroke has a lot of injuries. And number two, total brain injury. Number three, neurodegenerative conditions such as spinal cord injury, memory impairment, and some patients have Alzheimer's, right? Okay, so that's why it's very common if you talk to physical medicine and rehab specialists that they're doing regenerative medicine every day. Like almost constantly they think about how to make these patients return to the previous function. If they cannot do it themselves, the doctors have to think about other ways, right? So what about drugs failure? Many tragic happening in people with strokes, Alzheimer's, multiple sclerosis, because drugs that are used now as one size fits all fail to improve their situation many times. Many of them have other problems due to the side effect of these drugs. Once they have the side effects, the individual will have to struggle to go back to the previous function or normal life. Thank you to biomedical engineering field. They have already created a human tissue disk to test all the drugs And this is used to rebuild the world's best treatments, hopefully. So biologists, scientists, pharmacists, doctors, they all are working together right now for this purpose. In the future, in this kind of fields, doctors have to re-educate to follow the new invention. The expectation of the result is also different than the current drugs that conventional doctor use. For example, in Japan, where the population is more homogeneous, not too many people migrate to Japan from Africa or from Indonesia, or because of the language barrier and everything, right? So they are more homogeneous. This situation makes it easier for the Japanese to work for pharmaceutical regenerative medicine purpose compared to here, to US. The population in US is from all varieties of background. Stem cells mediated event is the primary care of any insult, meaning your symptoms should go away by itself, actually, because you have stem cells. If you still have leftover symptoms, that means your own stem cells cannot function fully, or not enough stem cells in your body. So regenerative medicine in the modern medicine means utilizing our own body to repair for tissue healing, or using other people's tissue or umbilical tissue or fat tissue to repair. So Dr. Christine Camilla, she is a physician. In May 10, 2018, she's from Fort Lauderdale, Florida. She's expert in regenerative medicine, said, you have stem cell and you cannot live without stem cell. Dr. Jim Weiss, he's a physical medicine and rehab specialist, has a stem cell center in Houston, Austin. He does regenerative medicine, and he does PRP, prolotherapy, which is PRP stands for platelet-rich plasma. We get it from your blood, and we spin it to get the buffy coat called PRP. And then we reintroduce it to where the injury is. So Dr. Weiss use it for spine problem or hip arthritis. And we need to stop throwing drugs in our body to protect our own stem cell. We need to use resources of diet, nutrition, lowering stress, perhaps things about detoxing our body, so our own stem cell can work better. Drugs can save our life, sure, but it is perhaps used for when we have no other resources. If we can alleviate one person's suffering, we can save the rest of the world by sharing these innovative treatments. We call it innovative treatments now. What is the dangers of using stem cell? Stem cell is often misunderstood by a layman person. Let me share some information. Okay, maybe this will improve the understanding, and so people are not afraid. Currently, stem cell is not approved by FDA, US FDA at least, okay, for the use of labeled condition or the use of diseases or claim and things like that. Okay, that's called label. Except those who are using it to treat cancer, like leukemia, okay, they use stem cell from the bone marrow. Mayo Clinic is the leading hospital for clinical study of stem cells and regenerative medicine. 2 years ago, Dr. Tom Shives. He is an orthopedist actively doing regenerative medicine and also relied on the body to restore and help healing itself. He repaired the damaged tissue of the patients and helped them to return to previous function. He forms and create again some of the alignments that were damaged. So in Mayo Clinic, another doctor like Dr. J. Smith, he's a physical medicine and rehab specialist practicing solely regenerative medicine. And he said, we stay harnessing our own body to help ourselves. So Dr. Andre Terzek, he is also physical medicine and rehab specialist in Mayo Clinic. He used CAR T cell for cancer as a cell therapy. Regenerative medicine is necessary with the goal of healthy aging. Why? Well, one, it can extend health span. So health span is number of healthy years. For chronic diseases, we can rebuild the health of the patients to gain their holistic human beings. For example, patients with heart attack can remarkably experience the heart regenerations, leveraging self-repair capacity by introducing stem cell for the heart. But of course, more research in this field is still needed. Organ can also be rebuilt. Mayo Clinic has been given a green light in regenerative medicine for this purpose, to restore and regain function of organs. Take patient's own cell and regenerate it is the purpose, and then so you can regain the previous organs functioned or the new organs functioned. There is a hair loss regenerative center in Florida. So you can imagine we can regrow our hair. So Dr. Rafael Sierra, he is from Mayo Clinic. He's an orthopedic surgeon, has done bone marrow concentrate to heal hip osteoarthritis so patient can walk again. How about Crohn's disease? Also get a good response in the wound healing using regenerative medicine. Dr. Steve Morend, he's an orthopedist, also tried to heal tendon and tissue. That's his specialty, by increasing the blood supply. Dr. Nathan Staff in a Mayo Clinic, he's a neurologist, using mesenchymal stem cell to treat ALS, amyotrophic lateral sclerosis, and Lou Gehrig disease by injecting the fat stem cell to the spinal cord. So this way, Dr. Staff will provide growth factors to protect more neuron, change the immune system, providing neuroprotection. So the future is to replace the neuron. I personally have been to Beijing Rehabilitation Center and visited Professor Huang Hongyin, a neurosurgeon. I think he's my first teacher in this aspect, He is the president of Neurorestoratology Institute. That terminology was so foreign for me until I saw the label on his department there, Neurorestoratology Institute. Over there, he treated several severe cases. I saw one 21 years old young lady with history of spinal cord injury from Middle East, and she was able to walk back and forth the corridor of the hospital with crutches. And 86 years old man, my father actually, receiving a neuron transplant injection to his brain, and 3 hours later, 3 hours after the procedure, he can walk, and he was not able to walk and sat in the wheelchair for at least three weeks. It's amazing. That's why I then decided to pursue this field also. This is not just a single technology. They cover young patients or adult patients with diseases such as a spinal cord injury patients, cancer, other neurological problems, hematology problems, lymphoma, leukemia, and many more conditions. They are talking about truly cure. Very exciting field that is not taught during any medical school at this moment. But we gain this knowledge from those research in the last 10 to 15 years. In summary, we can talk about regenerative medicine, several factors to be considered though, okay? One, the earlier age you take care of your health is the better result you get in regenerative process as your own medicine because you have your own stem cell. Number two, patient's medical condition at the time is also important. Number three, patient's own stem cell ability is a factor. Now, since everyone has their own stem cell to repair and help their healthy aging situations, it is very important for all of us to care for our own stem cells, right? Here are examples of positive activities. One, you have to select your choice therapy, whether it's drugs or medical food. You know what I mean, right? So drink 8 to 12 glasses of good water every day. Number three, balance your daily electrolytes, minerals, vitamins, and many other amino acid and protein, right? You have to know these, right? Basic, these are all my videos, previous or prior to today. So number four, you have to sleep at least 6 to 8 hours a day. Now when? Before 11 o'clock at night, before 11 o'clock at night. I will consider doing sleep video next time. Number five, balance your hormone. This helps improve brain function. Number six, avoid toxic environment. Number seven, check always biomarkers of the heart, cancer or tumor, also metabolic system, right? Number eight, balance nutrition according to your test result. You don't need it, don't take it. You need it, please supplement it if you cannot get it from your food. Number nine, communicate with your physicians at least once a year if you're healthy, and follow up diligently for your own good if you're not healthy. Some of you can doctor yourself, of course, but let me tell you, some of the natural ingredients that can be found in your kitchen, your cabinet, might not be concentrated enough to give you medicinal effect. I'll give you some example. I use green tea as an example, okay, in my book. This book as 650 milligram capsules. I make tea polyphenol. If you take 3 capsules a day, it will be equivalent to 20 cups of tea daily. It is easier to swallow 3 capsules than drinking 20 cups of tea a day. Or let's say 40 carrots is the same as 5,000 IU of beta carotene in a capsule. Some of you need 10,000 IU. it will be difficult to eat 80 carrots a day. It's easier to take 1 capsules of beta carotene. For what? For your eyes, right? So let's say 1 gram of fiber is about 10 head of lettuce. You need 15 gram additional fiber at least every day to prevent heart disease, okay? Now, that is about 150 head of lettuce. How can you do that? 150 milligram of magnesium malate, or I call it malic plus or malic acid, equal to 3 apples. We might need 600 milligram of magnesium at least, right? Or at least 4 capsules. Now that's equal to 12 apples. 12 organic apples might cost you not $4. I think a dozen of apple can be like $6, $7, or $8, right? But this malic acid capsule is only maybe 50 cents, not even $1. Sometimes you have to think that way. Plus, nowadays, all this food-based, plant-based supplement is very safe and very good quality. How long and how much you can take care of your health is the same as how much you can save by taking care of your own stem cell to do repair to keep you well in the future. It's not going to be cheap, very expensive. So maintaining it is much cheaper. Okay, regenerative process of natural medicine is what our own body stem cell have been doing every day. We do not want to insult our own stem cell. I hope this helped you understand and pass on to your family, friends, and loved ones. The sooner the better. So let me check if there is any questions here. So I think we are clear, okay? So I'm Dr. Maria from Pasadena, California. Please share my channel with your colleague and family or friends, and please like it. And rain or shine, I'll be live next Thursday, 5 p.m. Pacific Standard Time, September 3rd, and grow your knowledge in, I think, early detections of diseases. That's next topic. This will include, for the first time, information on special tests, such as biomarkers for the heart. Okay, that's for the heart attack, risk for heart attack. I will explain that. Just a reminder, please write your question in the comment or chat box. You can do it in the beginning. I mean, even after we post it. Thank you so much for listening.